Hi, my name is Peter Collins. I'm a fourth year psychiatric nursing student here at GMIT in Castlebar. My first year experience, I suppose the first year experience, it was about getting to know the group, first of all, getting to know the class, and that happened pretty quickly. We got on like a house on fire ever since. I suppose when somebody starts off a course in the beginning, there's always doubts in the back of your mind, but they were kind of put to bed straight away, really. There was a lot of support from the lectures that are very accessible here in GMIT and the other staff, and there was a lot of supports put in place, like study groups from the very beginning to help the student, at that kind of critical stage. So I found that it helped a lot. Starting off from first year, we got a broad range of learning opportunities. We got to learn about all the mental illnesses in first year and second year as well. We had placements in first and second year as well, but I suppose in third and fourth year the placements were, I found them more beneficial anyway. We were, after learning all the knowledge from first and second year, we got to act out on that knowledge, and I suppose we were able to act in a more autonomous way. Not saying that we didn't still have guidance from the CPCs and our link lecturers here and our preceptors out in the wards, but in third and fourth year we were able to maybe go out and we were able to carry out nursing assessments, which is what our role is mainly about, and to offer interventions for individuals experiencing mental health difficulties, and that was very rewarding. The most thing that I enjoyed about the programme was the variety from the theory on one side that we do here at GMIT in the lectures, and then getting exposed to mental health settings around Mayo and Mayo Mental Health Service, from I suppose acute mental health settings to community mental health settings, liaison psychiatry, addiction counselling. There was a variety, maybe dementia care as well. They were very enjoyable, and there was a broad range of learning opportunities there, which I found very beneficial. One of the most enjoyable parts of the 4 years was a trip that we were involved in to Edinburgh. Our class organised a trip along with our lecturers for us to observe the mental health services in Edinburgh, which was very beneficial. We visited some sites over there, and that was a great trip, great experience. Most of the placements were actually around the Castlebar area. There was one in Claremorris, Westport as well, but most of them were based around Castlebar, and there wasn't an awful lot of travelling involved, which was very helpful. And Castlebar there's a lot of services in the area, so it was great that I didn't have to travel too far. The most positive thing about the Mayo campus really is that it's a small campus. Everybody knows everybody, and it's easy to get involved, and everybody's very accessible, so that makes life a lot more easier. A lot of other colleges, I suppose, are a lot larger, and I suppose you maybe get lost in the numbers and you don't have that contact with your lecturers. Like, it's very easy just to approach a lecturer and ask them a question about any problems at all that you have, and that they're willing to help you. And I suppose like you mightn't get that same emphasis like in other programs, maybe in other colleges. So I found that very beneficial and helpful. Being a male in mental health nursing at the moment, there's a lot of job opportunities because there's a shortage of male mental health nurses, especially in the Mayo services anyway. So I am being optimistic about employment in the future in the services. So this course has given me a platform to be able to pursue that career. We have an awful lot of natural amenities around us that we can utilise, and that makes it easier for the outdoor activities and that students do get involved in. Myself personally, I have a great love of Gaelic football, so I've got involved in the GA club while I was here, and the last 2 years we've been reasonably successful. I think any student out there that is filling in the CO at the moment, I would highly recommend to consider mental health nursing as an option, and if so, the Mayo campus is a great facility where you can reach your potential and continue on to a career in mental health nursing. I think it's something that people should consider, and if you're interested in becoming involved in a profession where there's a caring aspect to your work, I think it's a worthwhile experience.